Joining me now from our bureau in New York City, urologist and director of men's health and urologic oncology at St. Francis Hospital, Dr. David Samadi. Doctor, there was a poll conducted by the Associated Press on vaccines. I'm sure the results are not surprising to you, given you're a physician. Roughly 50% say they would take a vaccine, a COVID-19 vaccine, if one is developed in the not too near future. 20% though say they will not take a vaccine. 31% say they're not sure whether they're going to do it or not. The bottom line is, doctor, we're never going to get 100% of the population on a vaccine. It's just not going to happen in America unless, of course, it is mandated by these governors or potentially the federal government, which would be a violation of this crazy thing called the United States Constitution. The bottom line is the governors know. These governors know that they're, in many cases, a lot of their population is not going to be vaccinated.
Graham, it's good to be with you, and we absolutely need to reopen our economy because we've said about the fact that the risk of people staying home from poverty to losing their life savings to psychological issues outweighs the benefit of what this coronavirus is putting on our society. Anybody that will tell you that we need to wait for the vaccine to open up our economy, it's more of a politician than looking at the science of itself. Vaccine takes, at best, many months to years. And that's one of the reasons why when rushing through this to get that vaccine, you have to be very careful because a lot of people are becoming more skeptical about this, especially when it comes to safety and efficacy of this. We need a vaccine that works not only for elderly, works for immunocompromised, works for people over 65, and certainly for our nursing home patients. And that's the group that we're really worried about, and that's where this invisible enemy is going after. So if you look at the data that you just presented, 40% of African Americans are not going to go for it. Many young, between 18 to 59, close to 50% of them are not going to get the vaccine. And so this is going to create a big problem. At the end of the day, the best defense against this is really the herd immunity, where 60 to 70% of the population in this country have those antibodies, and we will squeeze the hell out of this virus and we'll be able to open up our economy. And that's where we should be headed.
All right, I want to talk to you about herd immunity and antibody testing in just a moment. But back to what you were saying about the vaccine. I don't do a flu vaccine. And one of the reasons why my doctor says get one and I say no, I'll pass, is because I know that there's a new strain of the flu every year, every season, that the old vaccine does not cover, right? It mutates effectively. And so we're looking at a situation like that, are we not, potentially with the COVID-19 as well? As soon as there is a vaccine for this strain, it could mutate and form another strain that is not affected by a vaccine?
That's another big concern, that we're looking at about almost 30 different mutations of this coronavirus. And as AstraZeneca and Johnson & Johnson and Pfizer and many other companies are investing billions in these vaccines, it's very much possible that we may not get the right mutated vaccine. And you're 100% right. As you see every year, just like flu vaccine changes and the mutation changes, this also could be very true for coronavirus. And also because of the fact that there were some side effects with flu vaccines and neuropathy, such as like Guillain-Barré and other things, some people are very skeptical and they're anti-vaccine. What CDC is recommending that this year probably would be even more important to get the flu vaccine because they're worried about the two pandemics coming at the same time. At the end of the day, I think it's a personal choice. You have to look at the risk and benefit and see what makes sense for you.
Antibody testing, I want to talk about. There's a report out right now. The CDC says that the current antibody testing that's being performed right now isn't so accurate, that it could be wrong somewhere in the order of about half the time, and there are too many false positives going on out there. But what we have gleaned, and what I have gleaned, doctor, from reporting over the last 3 months, and different studies that have been done in Los Angeles or New York or what have you, and then overseas as well, it seems as though the numbers that keep popping up in terms of the antibody, the percentage of the folks who have antibody in various regions of this country, is somewhere in the order of 20, 25% right now.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube. And call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.